Dear Chairman, ladies and gentlemen, it is my pleasure to present you this study about the 9-year follow-up of ceramic and ceramic total hip arthroplasty at our institution. And I would like first of all to acknowledge my co-authors for their contribution. At our institution, we've been using cementous acetabular and femoral components for total hip arthroplasty since 1995 and ceramic bearings since 1999. At that time, we started with 28 mm Biolux Forte ceramic heads. 32 mm heads became available in 2002 and 36 mm heads in 2003. Since the beginning of our experience, we've been using a single design of hip implants. The Horizon Cup, made of titanium and covered with hydroxyapatite, and the Integral Stem, also made of titanium and fully hydroxyapatite coated. Since 1999, more than 1,100 such total hip arthroplasty implants using ceramic and ceramic bearings have been implanted at our institution. The aim of the present study was to assess the mid to long-term results of the first 100 ceramic and ceramic total hip replacements performed at our institution. So we performed a retrospective study, including 92 patients. 8 of them had a bilateral hip replacement. There were 59 males, 33 females. The mean age at surgery was quite young, 52.3 years, ranging from 20 to 73 years. 96 of these total hip replacement had been performed during primary procedures and 4 of them during revision procedures. Most of the total hip arthroplasty had been performed through an anterolateral approach. All of them used a 28 mm ceramic head, and most of the time a standard neck length had been used. The 3 main underlying diagnoses responsible for the total hip arthroplasty replacement was primary osteoarthritis, osteonecrosis of the femoral head, and developmental hip dysplasia. We used Harry hip score and PMS score for clinical evaluation, and radiographic evaluation was performed by 2 independent senior surgeons looking for signs of loosening osteolysis and heterotropic bone formation. So what were the results? At last follow-up, 4 patients were lost to follow-up, and 7 patients died of unrelated causes, leaving 89 hips in 81 patients available for this study. Of these 81 patients, clinical evaluation had been performed for 100% of them, and 89% of these patients were available for radiographic evaluation. The average follow-up was 106.6 months, ranging from 72 to 125 months. PMA score and Harris hip score significantly improved at latest follow-up. Among the intraoperative complications, 3 cases of calcar cracks had been reported, treated by a cerclage, and cup liner fracture was reported in 1 case at the time of the insertion of the liner. Postoperative complications reported 6 cases of dislocation. 5 of them occurred during the first 3 months and 1 after 1 year. All these dislocations were managed by close reduction with no recurrence, no need for revision surgery. Among the postoperative complications, we also reported 5 cases of squeaking. None of them required any revision. 1 case of aseptic loosening of the cup, treated with a cup revision. No ceramic head fracture. And among the non-specific complications, we reported 2 patients with psoas syndrome. 1 of them had been reoperated on with the removal of the screws that had been inserted to secure the fixation at the time of the insertion. Regarding the radiological results, we had excellent osteointegration of the cup in 91% of the cases with no loosening, no migration, no osteolysis. We reported in 7 hips non-evolutive radiolucent lines around the cup, 3 in zones 1 and 2 and 4 in zones 2. And we also reported 1 case of evolutive radiolucencies in zone 1, 2 and 3, also with a tight pain that this patient had not been revised at the time of the study. Regarding the femoral component, we observed 92% of calcar osteolysis, limited osteolysis, no stem migration. Non-evolutive radiolucencies was observed in 7 cases in zone 1 and in 5 cases in zone 1 and 7. And we also reported 35% rate of heterotopic ossification, most of the time a grade 1. A review of the literature showed that several studies have reported the use of ceramic and ceramic bearings for total hip arthroplasty. Among them, few have reported the use of cementless implants, and the present study has the longest follow-up with the use of ceramic and ceramic cementless total hip arthroplasty implants, while the others have a follow-up of around 5 years. Our study reported 97.7% of cup survivorship at 9 years with a revision surgery for aseptic loosening at the end point. The stem survival is 100% at 9 years under the same conditions, and considering both the stem and the cup, the survival is 95.8% with any cause of revision at the end point. A 6% rate of dislocation has been reported in this study. Such a high rate can be related to, first of all, a variable experience of the surgeon, because we are working in an academic hospital with senior surgeons and less experienced fellows. This high rate of dislocation can also be related to the exclusive use of a 28mm head during the study period, and also navigation was not available at that time at our institution. In a report from you and collaborators, no instability was reported, but only one single senior surgeon performing the hip replacement had been reported in this paper. And other authors published the use of 32mm heads with an improved stability. We report one case of cup liner fracture secondary to the technical error at the time of the impaction of the liner. Other authors have also reported such complications. Fortunately, no influence on the long-term results have been reported. We also reported 5 patients experiencing squeaking phenomenon after total hip replacement with ceramic and ceramic bearings. The prevalence in the literature is highly variable, ranging from 0.3% to more than 20%. Metal transfer has been reported as a contributing factor, and further investigations are necessary. We report a 92% of moderate osteolysis of the cardiac site, which is in agreement with other reports. Such a result does not affect the long-term result of the femoral component fixation, with 100% survival at 9 years follow-up. In conclusion, we report encouraging mid to long-term clinical results and radiographic results with the use of cementless ceramic and ceramic total hip arthroplasty implants with no wear and no fracture of the ceramic head. The use of larger ceramic heads, 32 or 36mm, and the routine use of navigation systems since 2005 allowed us to significantly reduce the dislocation rate in these young and active patients. For these reasons, ceramic and ceramic cementless implants have become the implant of choice in our current practice for total hip arthroplasty in young and active patients. I thank you very much for your attention.